Hi, I'm Dr. Elizabeth Held. I'm one of the Inova cardiac electrophysiology physicians. I take care of patients with atrial fibrillation both in the Inova AFib Center and in the hospital. I'm here today to discuss women and atrial fibrillation, specifically in regards to sex differences in the epidemiology of AFib, its presentation, and risk factors. I'll close with a brief discussion on the Inova AFib Center and how we approach and evaluate and manage atrial fibrillation. Atrial fibrillation is the most common cardiac arrhythmia worldwide. By age 55, the lifetime risk of developing AFib reaches nearly 1 in 4 in both women and men, and gender plays a role in this. The incidence of AFib among men is 1.5 times the rate among women. However, because women on average live longer than men, the absolute number of men and women with AFib is similar, and by age 75, AFib is actually more common in women than in men. Early detection and treatment of AFib is associated with better outcomes for all AFib patients. Unfortunately, women tend to be diagnosed and treated later in the disease course, likely because they more frequently present with more atypical symptoms of AFib, such as weakness, fatigue, etc., rather than palpitations. They also tend to be more symptomatic and report lower quality of life with atrial fibrillation than do men. Risk factors for AFib also vary by gender. For instance, hypertension is more prevalent in women with AFib than in men with AFib. There is also a stronger association between valvular heart disease and AFib in women. How about pregnancy and atrial fibrillation? AFib in pregnancy is reassuringly very rare, occurring in just 0.06% of pregnancies, and thus it hasn't been well studied. We do know that the risk of AFib is higher with increasing pregnancies, increasing maternal age, and also with gestational hypertension and gestational diabetes. Physical activity also differentiates men and women in terms of AFib risk. In both sexes, a sedentary lifestyle increases risk. However, vigorous exercise, such as high-intensity endurance cycling, has been associated with increased AFib risk in men, but not in women. Finally, I'll discuss stroke risk in AFib. Patients with atrial fibrillation have a 5 times increased risk of stroke compared to people without atrial fibrillation. Women are at greater risk of stroke from AFib compared with men, even when you control for the presence of blood-thinning medication. And data shows that despite this, and for a reason we don't quite understand, women are actually less likely to receive anticoagulation therapy from their physician. In addition, women experience more atypical symptoms of stroke, which can cause delays in recognition and management of stroke, which themselves can result in increased stroke-related disability. All of what I've discussed should serve to underscore that AFib is a complex disease. An understanding of the sex differences in epidemiology and risk factors is critical to improving outcomes and reducing any possible disparities of care between women and men. At the Inova AFib Center, we manage patient symptoms and work to prevent complications by tailoring our care around each patient's individual characteristics, needs, and preferences, including gender. Thank you for learning more about women and atrial fibrillation.